I'm certainly in no way trying to denigrate those amendments that have been offered, but we have to understand not a single one of them has been adopted. And I don't know what we're trying to accomplish here. We have listened intently. Most of the comments from our side has been from the chairman of the Finance Committee, because most of these issues deal with jurisdiction that he has. But it's very clear that there's no attempt to improve the bill. There's an attempt to destroy this bill. And we already have a law in place. It's the bill that we passed here on Christmas Eve, 2009. That is the law of this land. This is a matter to improve that.
This amendment is based largely on the extenders package that passed the House last week. It includes a 30-day extension of unemployment insurance, COBRA coverage, and the SGR Medicare physicians payment fix. It includes provisions on federal poverty guidelines, national flood insurance, satellite television, and compensation for highway programs. There is one very important difference between my amendment and the House bill. My amendment is fully offset. We can do this without adding to the deficit. I urge its passage. Reserve the balance of my time.
This amendment clearly is a killer amendment designed to just send this reconciliation bill back to the House, and there we go all over again. Mr. President, the goal of health care reform is to increase coverage so more people have health insurance. That's the goal of health care reform. What does this amendment do? It goes in the opposite direction. Compared with the bill just signed by the President, this amendment will cause many more people to lose health insurance. Why? Because it lowers the income threshold from 8% down to 5%. That's going to mean fewer Americans get tax credits to pay for health insurance. That means fewer Americans are going to have health insurance compared with the current law. That's why the main reason why we should vote against this, because it expands the number of people who are uninsured rather than expand the people who would be insured. The provision the Senator talks about, frankly, was changed in the current law because with health insurance, people have less need for that deduction and have less need for catastrophic coverage because health insurance will pay for it.
Mr. President, I ask unanimous consent that when the Senate completes its business today, it adjourn until 9:45 a.m. today, Thursday, March 25th. That following the prayer and pledge, the Journal of Proceedings be approved to date, the morning hour be deemed expired, the time for the two leaders be reserved for their use later in the day, and the Senate resume consideration of H.R. 4872 as provided for under the previous order.
Without objection, so ordered.
Mr. President, senators should expect a series of roll call votes in relation to amendments and motions to the reconciliation bill at approximately 9:45 a.m. Under the agreement reached tonight, we expect to complete action on the bill around 2 o'clock p.m. tomorrow.